The cricothyroid membrane is an avascular structure situated between the thyroid cartilage and the cricoid cartilage in the interior part of the neck. The thyroid cartilage, here illustrated in red, is the Adam's apple, and it's relatively easily palpated. The membrane is situated right below it, and below this is the cricoid cartilage, here in yellow. There are, of course, many important vascular and anatomical structures in the interior part of the neck, but the use of the cricothyroid membrane for tracheal access is relatively safe. There are also techniques using ultrasound which may further facilitate orientation. The system used in this video is the Melker wide-bore cannula over needle cricothyroidotomy set. If time allows, the front of the neck should be cleaned with an appropriate skin solution and the area prepared as a sterile field, but this should not significantly delay the procedure in an emergency. When the anatomical landmarks have been identified, a cannula is inserted, attached to a small syringe filled with a small amount of saline solution. Careful aspiration when introducing the needle results in bubbles when the tip reaches the trachea. A wire can then be inserted through the needle using the Seldinger technique. Taking care that the needle position is not lost, the wire is introduced and it should glide easily without resistance. The needle is then removed, leaving the wire in situ. At this point, use a scalpel to make a horizontal incision into the cricothyroid membrane along the guide wire. Note that some experts argue that the preferred order is a vertical incision prior to cannulation, but this is the preferred order at our center. The cannula is preloaded over a dilator and the whole assembly is inserted over the guide wire as shown. The wire and the introducer can then be removed. The cuff is now inflated, and while being very careful not to dislodge the cannula, the location is confirmed by using a capnograph and observing the raising of the chest wall during ventilation. A pertinent airway has now been achieved.